This is the 2023 Texas Balance of State Continuum of Care orientation. And we're so glad to have you here. My name is Margaret Hill. I'm the governance coordinator at Texas Homeless Network. This presentation will be recorded, as you just heard, and it will also be posted on the THN YouTube channel after the meeting. Closed captioning is available if you need it. Just click on the live transcript button and then the show subtitle button. In this presentation, we will be covering the topics on the slide here. We will go over, this is the introduction part. We'll go over some terminology and concepts. We will talk about local homeless coalitions, the point in time count, the homeless management information system, federal funding, Texas Homeless Network staff, getting involved with us, and we'll also have some time at the end for questions. So for the purpose of ensuring that we have enough time to get through everything, we won't take tech questions until the very end. So you'll see here, there is a Q&A function within the presentation that you can click on. If you have questions, please put them in there and we will get to them at the end. Or you can also type them into the chat, that's easier. All right, so Texas Homeless Network is the collaborative applicant of the Texas Balance of State Continuum of Care. We are also the Homeless Management Information System lead agency. So we'll get into what those terms mean later on in the presentation. THN is also an advocacy organization, and we are located in Austin, Texas, although we do have employees in lots of different places within the state. So what is a continuum of care? The CoC system was created through the CoC interim rule. It's administered by HUD, which is the Housing and Urban Development. It is intended to be a collaborative way for different organizations within a geographical area to plan and fund homeless services. So rather than everyone in a community working alone to solve homelessness, the CoC system is intended to bring organizations together to discuss the needs of the community as a whole. The intent of the CoC system is to make sure that everyone seeking services can easily access them. And also that those services are not duplicated within the system. The organizations that participate in that system can apply for certain types of funding. And to help them, which would help them provide services within their local housing crisis response system. And a balance of state CoC is made up of parts of a state that don't have their own CoC program. So most CoCs are centered around cities or counties or a group of counties. The areas that are not covered by those local CoCs are part of a balance of state CoC. Texas actually has one of the largest balance of states in the country. There are 11 CoCs total in Texas. The Texas Balance of State CoC is in orange here. There are 215 counties in the CoC, which is out of 254 total in Texas. And as you would imagine, serving a large area like this is very challenging. Unlike a smaller CoC, the populations that we're serving have very different needs depending on the community. Also, the Texas Balance of State Continuum of Care has a governance structure that allows staff here at THN to receive guidance from the CoC. The general membership of the CoC is made up of anyone that lives or works within the geographic boundaries of the CoC. And it's also anybody who is interested or involved in homeless services within that area. When we talk about the general membership, of the CoC. They also elect a CoC board, and that's also made up of general members. The CoC board makes decisions about CoC funding, planning, and governance. The board has the ability to create committees. These committees serve as consultants on specific issue areas that are relevant to CoC operations. And Texas Homeless Network is the collaborative applicant and HMIS lead agency of the Texas BoS CoC, and we receive guidance from the board. Local homeless coalitions, or LHCs, and coordinated entry planning entities, or CEPEs, serve as local planning entities. And you'll hear more about what those are later in this presentation. Again, my name is Margaret Hill. If you have any questions, you can reach me at margaret@thm.org. And Mary will be presenting next on some terminology and concepts. So I'll pass over to Mary.
Good afternoon, everyone. I'm Mary Stalkey, the Director of Engagement for the Texas Balance of State Continuum of Care. And I wanted to share with you some ideas about some terminology and concepts related to the CoC program and to Balance of State CoC. You will see Craig just put a link to a document that has some terms, some concepts, some acronyms that you can read through on your own. But what I wanted to do right now is talk a little bit about how you might view those terminology, those concepts and terms. So Margaret, if you go to the next page or slide, there you go. So as Margaret mentioned, under Continuum of Care, that is a term that HUD defines. We have the Balance of State Continuum of Care, which is that 215 county area in Texas that operates as one system in a way, as well as a little bit of like regionalized or localized efforts also. We've got the Continuum of Care program, which is a grant-funded program through the U.S. Department of Housing and Urban Development, or HUD. And that is one of the main sources of funding to address homelessness across the country. So you'll hear us say CoC program quite a bit. And then finally, the legislation that guides the Continuum of Care program and a lot of the work that we do is the HARTH Act, or Homeless Emergency and Rapid Transition to Housing, which spells out HARTH Act that was passed in 2009. And it really does, again, give the regulations for the running of the CoC program that guides all the work that we do. There are some groups that you can think about in terms of the CoC program and what we do here. As I mentioned, U.S. Department of Housing and Urban Development, or HUD. They are the main federal agency that addresses not only housing, but also homelessness. The U.S. Interagency Council on Homelessness, or USICH, they're a group of federal agencies that work together to address homelessness. And that group actually just a few months ago released the Federal Strategic Plan to Prevent and End Homelessness. It's called All In. And so we will be using that as somewhat of our guide in the work that we do on the CoC level as well. There's a similar organization on the state level called the Texas Interagency Council for the Homeless, or TICH, and that's a group of state agencies that work together to prevent and end homelessness. And they are actually in the process of finalizing a state plan to address homelessness. I don't know if it's been released yet. I haven't seen that it has been, but hopefully it will be very soon. And then, as Margaret mentioned, local homeless coalitions. And those are groupings of people within an area of the CoC that work together more locally to address homelessness. All right, next slide. There are some important definitions that the U.S. Department of Housing and Urban Development, or HUD, has related to homeless and chronically homeless. And those definitions are important to know, especially if you're operating a program that requires the participants who participate in your program, if they have to meet the HUD definition of homeless or chronically homeless in order to be eligible to participate. So we want to make sure that you have those definitions. And again, you can find that on that terminology document. And then finally, different kinds of interventions that we work with and we try to help agencies to carry out within the COC. You'll hear more about this later from some of our presenters, but just kind of in a nutshell, we want to talk about everything from homelessness prevention to reaching people where they are, like street outreach or wherever they happen to be staying. Diversion is basically, can we get people help through their family or friends or a mainstream non-homeless resource so that we can divert them away from the homeless service system altogether, so they don't even have to go into a shelter or another kind of homeless situation if we can help them find something, a better alternative. Then there's emergency shelter and transitional housing, which is short-term housing. Emergency shelter is often in a shelter, but we also have some housing interventions called rapid rehousing and permanent supportive housing that you'll hear about later, where we're actually working with people while they're in housing with some support services available. All right, and then finally, what activities do we do as the COC? Well, there are certain things that HUD requires, and they make for a coordinated homeless response system. So we're talking about planning, applying for funding, specifically COC program funding, conducting the point in time count and housing inventory count, operating and using the Homeless Management Information System, or HMIS, and operating coordinated entry, or CE. And I know we're throwing a lot of terms at you, some acronyms as well, but the rest of the presentation will build upon what we're talking about right now. So again, just kind of wanted to have you have the document and then this grouping of some of the terms so that you can hopefully get to a better understanding of what they all are. And I think that ends my time. Thank you so much. There's my contact information in the slides. And I will turn it over to the next presenter.
Hey, thanks, Mary. Hi, everyone. I'm Jen Beardsley, the Local Homeless Coalition Coordinator here at Texas Homeless Network, and I'm here today to introduce local homeless coalitions. Sweet, thanks. All right, so to set the stage for coalitions, I want you all to bear in mind that everything in orange on this map is the Texas Balance of State Continuum of Care. And as was mentioned earlier, it encompasses 215 counties, which is an area larger than most US states. So big area. Thank you. So most continuums of care in the US are densely populated and cover a smaller geographic area, such as a county or a cluster of counties or a city. COC lead agencies that operate in smaller geographic areas have the advantage of proximity to their communities and to the partners they need to address homelessness, meaning it's a little bit easier to operate as one planning body for the entire region. But this is definitely not the case in the Texas Balance of State Continuum of Care. Next slide. Thanks. So in an area this large, it is impossible for one agency to meaningfully bring together every agency and advocate that needs to be involved in coordinating an effective homelessness response system across the entire geography, especially considering how diverse the needs and resources are from county to county, and how many actors need to be involved in a coordinated response to homelessness. Planning as one region would not make sense considering the differences in local resources, needs, and stakeholders. And so at this point, you may wonder why our geography is so large, if it is so difficult to coordinate across such a massive region. And a lot of that has to do with how the Continuum of Care program was developed by the Department of Housing and Urban Development, or HUD. But unfortunately, I don't have time to go into all of those reasons here. The main takeaway is that a low population density and the number of people experiencing homelessness in a region factors into how much planning and program dollars HUD makes available to continuums of care. So our 215 counties, because they're not as densely populated as big urban areas, are actually stronger together than separately because more money is available to them than if they were their own continuum of care. And in fact, about 10 communities that previously had their own COCs opted to join the Texas Balance of State since it was created. Okay. And to meet the unique challenges of covering such a large area, larger continuums of care typically break down into smaller planning jurisdictions. And in the Texas Balance of State Continuum of Care, we call those smaller planning bodies local homeless coalitions. Okay, so local homeless coalitions are formed locally, meaning a group of interested folks get together and apply to be an LHC. And then we support them in developing a system to address homelessness using the resources that they already have in their communities. We also provide guidance on how they can better position themselves to, over time, increase resources to address homelessness. So keep in mind, this is a slow process that involves a lot of data gathering, strategic planning, and sharing information, which translates honestly to a lot of talking and not necessarily constant action. But moving in this more strategic and intentional way does position communities to better understand and address local homelessness. Yeah, so taking the time to create a planning body to understand what resources already exist in your community, what duplication of services may be present, and what gaps exist, improves service providers' ability to act more as a unified system. And it also creates an environment where resources can be shared and partnerships formed. So an example of resource sharing out of a more rural county is the one agency had like too many diapers that were being donated to it, and they had like diaper overstock. And there was another agency that was in desperate need of diapers. They never had enough. So they just passed along those diapers so that it was more distributed equally across their geography according to the population served needs. And a more complex example that comes from a more developed local homeless coalition was that a hospital partnered with a shelter so that they could transfer unhoused clients recovering from surgery and expensive hospital beds to more affordable shelter beds. And the hospital actually provided some funding to make that happen. And so if you're not already connected to your local homeless coalition, you can go to thn.org and then click on the Texas Balance of State Continuum of Care drop-down menu and click on Join Us, and then click on Local Homeless Coalitions. And you can also, on that local homeless coalition page, you can check the map to see if a coalition already exists in your area, or in the next slide. You can also click here to access current homeless coalition contact information to see if your county is already covered by an existing coalition, local homeless coalition. And finally, if you have any questions, you can please feel free to reach out to me by email or phone. My email is jen@thn.org. And thanks for listening. And with that, I'll turn it over to Ava.
Thanks, Jen. Hello, everybody. Welcome to the point in time count section of our COC orientation. My name is Ava Paredes, and I'm the data coordinator here at THN. I'm your go-to person when it comes to everything pit-related, excuse me. I'm your go-to person when it comes to everything pit-related. So let's just go ahead and get started and talk a little bit about what the pit count actually is. I'm actually seeing that we have several pit leads here today in this meeting. So I just want to shout them all out real quick. Shouts out to all our pit leads. So what the pit count is essentially a federally mandated large-scale data gathering initiative that surveys individuals and families experiencing homelessness that is conducted annually across the Balance of State CoC. We conduct this survey on one night in the last 10 nights of January, which are usually the coldest nights of the year when there are more cold weather shelters open and people are going to be more likely to be accessing services. So in this comprehensive survey, I like to think of it almost as like a census, but for our unhoused neighbors. In this comprehensive survey, we want to paint a picture of people experiencing homelessness within our vast geography. And we do this by gathering qualitative data, meaning we gather their demographics, how long they've been homeless. We also look into or survey chronic conditions that may affect their ability to acquire and maintain housing, and several other factors that contribute to homelessness. We are also conducting, we're also counting quantitative data by determining the number of people experiencing homelessness within our geography, amongst our LHCs, and within smaller counties within our CoC. So we are also looking at people experiencing sheltered homelessness in, like we mentioned before, emergency shelters and transitional housing, as well as a count of unsheltered people on the street, which we would like to refer to as the street count, which looks for people, of course, on streets, sidewalks, outdoor encampments, and other places not meant for human habitation. Okay, so let's move on to how we actually accomplish this count. So our CoC has a huge geography, like we've talked about before, with over 200 counties. That's bigger than some states. And because of this huge geography, we need many dedicated and hardworking individuals to cover this area and survey people experiencing homelessness. So each region or county will typically have a pit lead that is in charge of training volunteers and shelters to gather the pit data. So the pit lead could be you. We have several pit leads here today. Again, shouts out to all our pit leads. Someone within your LHC, someone within your organization, even a community leader or someone who works at a shelter, maybe even someone who just wants to get more involved with their community. So my role as the data coordinator is to train our pit leads so that they're able to train these volunteers and be fully prepared for the night of the count. I also coordinate with pit leads so they have everything they need to complete the count, be it understanding our surveying tool counting us, being able to troubleshoot that with our volunteers. And believe me, there's always a lot of issues on the night of the count when it comes to counting us, but we always do our best. Also coordinating volunteer recruitment, how to use incentives, and how to actually gather the data in a comprehensive manner that also respects the humanity of our respondents and their confidentiality and privacy. So for the shelter count, we usually rely on shelter staff to gather the data for those individuals in shelters. And for the unsheltered count, we rely on pit leads to, again, train those volunteers from their communities on how to properly and comprehensively gather data of folks who are unsheltered on the night of the count. All right, so my favorite graphic in the world is here again. So why do we even conduct the pit count in the first place? So there are four main reasons that we conduct the pit count, represented here in this graphic. Of course, we conduct it for awareness, to raise awareness within our community of our unhoused neighbors and advocate to local governments. We want to understand the extent of homelessness. Of course, we gather this quantitative and qualitative data. It allows us to understand the characteristics of those who experience homelessness within our communities. And we can compare this data to previous years to understand trends in homelessness over time. Of course, this data can be used for funding to advocate for private or local government funds, and used for eligibility for CoC, ESG, and other federal funds. And finally, I think this is the most important component for engagement, because it allows us to go out there and actually talk with our unhoused neighbors and develop personal relationships with those who are experiencing homelessness currently and create a shared sense of responsibility amongst various stakeholders. The PIT count requires a great amount of cooperation amongst various sectors and pillars of our communities. So it's just a great opportunity for us to do that. So yeah. All right, so that wraps up my little section about the point in time count today. If you have any general questions or questions about maybe the 2024 PIT count, perhaps you'll maybe want to expand your coverage or get your area involved if you haven't been involved in the past, you can always email me or give me a call. My email is ava@thn.org, and I will be in touch with you. Thank you so much.
Thank you, Ava. All right, so we're gonna take a 5-minute break because I know that's a lot of information to absorb. So be back here at, let's see, 2:33, looks like. All right, so yeah, we'll see you back here at 2:33. are back from break. Welcome back, y'all. Let's get started again. So our next presentation is going to be about HMIS, and Aubrey will be presenting that, and I will hand things over to Aubrey.
Thanks, Margaret. So, like Margaret said, my name's Aubrey Fetzer, and I'm the HMIS data analyst on our data team at the Texas Homeless Network. And today I'm going to talk a little bit about HMIS and some of the many benefits of utilizing the Texas Balance of State CoC HMIS system. And you can take me to the next slide, Margaret. Thank you. So what is HMIS? HMIS stands for Homeless Management Information System, and it is a computerized data collection tool specifically designed to capture client-level information over time. It collects information on the characteristics and service needs of individuals and families experiencing homelessness, as well as the services provided to those clients. And also, depending on the type of funding source your agency receives, like some type of federal funding source, for example, you may be required by that source to use your CoC's HMIS for data collection and reporting. But next slide, thanks. So to start, I'm going to cover some of the benefits of HMIS specifically for providers. So one of the first major ones is data-driven decision-making. When you make decisions about how your programs should operate, you want to know that you're basing those decisions off supporting data. HMIS provides a way for agencies to assess program performance, allowing you to see what's working and what may need improvement. Another benefit is utilizing reports to better understand the population you serve. So our HMIS not only has the reports that HUD requires, but also has dozens of additional reports that focus on client demographics, services, referrals, and data quality. So these reports can be utilized regardless of funding, just to get a sense of the population that you serve. Another benefit is having organized data for system performance measure and longitudinal systems analysis reports. So LSA and SPM reports are mandatory to send to HUD. Both of these reports provide CoCs with a look at their overall system functioning. Our users work diligently to ensure high quality data to represent the functionality of our system. Next, we have coordinating services within your agency and other agencies. So if a client has accessed multiple programs and services from your agency, you will be able to see that on the client's HMIS dashboard. If other providers in your community also utilize our HMIS, you will be able to see if the client has been served by other agencies. This helps the process of coordinating services. And lastly, one of the last major benefits for providers is HMIS provides tools to gauge client outcomes and larger agency-wide outcomes. So our HMIS data can answer questions such as, how long was the client in your program? Where did they end up? What services did they receive and did they reach their goals? Or did your agency meet its own housing goals? So if you can go to the next slide, I'm going to talk about some of the major benefits of HMIS for communities. So the first major one is being able to understand the extent of homelessness in your community. HMIS creates an environment where community level data can be analyzed and interpreted, giving an important opportunity for system-wide policy decisions. Another benefit is identifying service gaps. HMIS makes it easy for administrators to find service gaps in the data by recording unmet needs, identifying returns to homelessness, and viewing waiting lists for permanent housing programs in your community. Another benefit is having unduplicated client counts. HMIS client level data is consistently audited for accuracy. HMIS administrators, like our data team at THN, comb through the system to ensure data accuracy and verify any unduplicated count of clients accessing services in the community. And lastly, one of our last major big benefits is informing system design and policy decisions. So by utilizing data to identify service gaps in our communities, we can better inform local and national policymakers. And then lastly, I'm just going to touch on some of the major benefits that HMIS can provide for our clients. So the first one is coordinated case management. HMIS provides a way for case managers within different programs or agencies to see what assessments, services, and referrals a client has received. Another benefit is streamlined referrals. So you can see when a referral was made to where and for what, as well as the status and result of the referral within HMIS. And for referrals to providers that also use HMIS, the referral is digital and instantaneous, meaning the client doesn't need to personally or manually keep track of their own referrals. Another benefit is the decrease of duplicate intakes and assessments for clients to have to complete. So when clients are entered into the HMIS, their basic demographic information is saved to their personal record. And also users can see when a client already exists in the system. So this cuts down on potential duplication of clients, their standard intakes and assessments. And then lastly, and most importantly, HMIS allows us to be trauma-informed and client-centered service providers. So HMIS assists assessors in creating a trauma-informed space for clients who do not have to tell their story over and over and over again. And that's all that I have to share with you today. So if you have any questions about what I covered or would like more info about HMIS, please contact our training coordinator, Gabrielle Llamas. Her contact info is on the screen. But for now, I'm going to pass the mic over to Jim and Hope to talk about federal funding.
Hey, everyone. Welcome. My name is Jim Ward. I'm the Director of Planning here at Texas Homeless Network. I will not be joined by Hope for this part of the presentation, but we're anticipating that she'll arrive shortly after 3 o'clock for Q&A. So I wanted to talk briefly about federal funding. That's a question that we get a lot in terms of, what's available, how do we access it? Oh no, we've got it. What do we do now? So we're going to address the first part of that equation today, specifically the types of federal housing interventions. And notice I said housing. We're not going to talk about emergency shelter or street outreach. We're going to focus specifically on housing interventions. And then I'd also kind of like to talk a little bit about the considerations of an agency or a community when determining whether or not it's appropriate to apply for federal funding. And then specifically some recommended prerequisites for applicants. So if you could take to the next slide. So in general, whether you're talking about HUD or you're talking about the VA or even to some extent Health and Human Services, these are the interventions that I'm going to discuss are pretty much universally accepted or understood to mean what they say on the screen here, right? So rapid rehousing, for example, typically is a short to medium term housing intervention. So somewhere less than 24 months. There are some limited exceptions to that where you might see a rapid rehousing program go up to like 36 months. But typically the shared characteristic there is it's time limited, right? So it's going to end at some point. It's really geared around helping folks from that immediate housing crisis into stability and then on to market rate housing or some other longer term solution to their housing crisis. So that's accomplished through wraparound services, typically like holistic case management. So that's like a case manager that's working on everything from mental health to substance abuse to housing stability to income growth, you name it. Holistic case management works to address, identify the issue and then address it either internally at the organizational level or through partnerships in the community. So that's a shared characteristic between rapid rehousing and permanent supportive housing. Permanent supportive housing, or PSH, is a non-time limited housing subsidy. So that is exactly what it sounds like, right? Someone could be in permanent supportive housing theoretically, until they're no longer eligible or no longer require the housing subsidy and supportive services. So similarly, PSH really leans into the service needs of the folks that it's attempting to serve. Specifically, these are people that are least likely to resolve their housing crisis without some intensive intervention. If you're doing coordinated entry in your community, these are folks that would score at kind of the higher end of the vulnerability range on the coordinated entry assessment. And when we're talking about kind of what does a community need more of or less of, typically we'll see rapid rehousing making up the bulk of a community's housing crisis response. That's what most people need. That's what most people are going to qualify for. But there is a growing, in some communities, a growing segment of the people experiencing homelessness that need permanent supportive housing. It's a critical piece of that ecosystem, the housing ecosystem. In addition to these two interventions that I think are pretty well known at this point, they've both been around for more than a decade. HUD, liking to keep everyone on their toes, has come up with a new housing intervention type called joint transitional housing and rapid rehousing. So you might hear that called joint, the joint component, THRRH. It essentially combines both transitional housing and rapid rehousing into a single project, where a participant can benefit from one or both of those components. And it's really driven by client choice, right? So the idea with the joint component project is that someone is matched with the housing intervention that best suits their individual needs and strengths, as opposed to only having access to this or that. The key difference between transitional housing and rapid rehousing is transitional housing is typically under the control of the administrator. So if in the case of a nonprofit administering housing assistance, they would enter into a lease with a property owner or management company and then sublease to the participant. Whereas with rapid rehousing, you were talking about people leasing units in market rate housing where they are the leaseholder and have the contractual obligation to the landlord. So really there's, you can see that's kind of really different ways of approaching a housing crisis. And the idea with transitional housing or this joint component project is that it gives recipients the flexibility to address the needs that people are presenting with. And then finally, I just want to kind of address briefly homelessness prevention. Homelessness prevention in general is not something that can be funded through the Continuum of Care program, but it is kind of a general term for an intervention that's intended to prevent homelessness by keeping people in their homes. Just before this webinar, I was looking at something from Texas Housers that says that evictions are back to pre-pandemic levels, right? There were something like 277,000 evictions in the state of Texas in 2022, which is an astronomical number. The idea with homelessness prevention is we want to keep people from entering into emergency shelters or going to unsheltered homelessness, either in their car or on the street or wherever. Next slide, please. So we get a lot of questions about, again, when is it appropriate to apply for federal funding? So that we have a kind of a laundry list of things to consider. Really, we're going to put those into two buckets. One is the capacity of your housing crisis response system in your community. And then second, and not necessarily in either order, the capacity of the applicant that's actually applying for funding. So before someone applies for either Continuum of Care program funds or supportive services for veteran families funds, it really should take stock of the local homeless coalition, right? Is there a local homeless coalition in the community? Is there a coordinated entry system in the community? Is the area conducting a point in time count or housing inventory count? And then really leaning into the housing crisis response system locally and identifying change agents within the community, right? That will agree that I think it's time for something a little bit beyond what we've been doing. And so really trying to find champions for the cause around addressing homelessness through bringing in federal dollars. I will say that it is, it's a little bit of a departure from a localized response, right? You're actually asking for the federal government to help you address homelessness. And so that comes with some additional hoops to jump through. And then when we're talking about the capacity of the applicant, this is one that I think is where you can really get lost in the weeds. But specifically, federal dollars typically will come with a match requirement. So that means if you ask HUD for $100,000, they're going to ask you to put up anywhere from $25,000 to $100,000 as a matching contribution towards their investment. So that is something that most federal funders take very seriously. HUD is no exception. They will want to see evidence that you have contributed the match, that you have a match source going into the grant agreement, all that sort of thing is something that needs to be sorted out before they will obligate or even authorize any expenditures. So that's something to really think about going into any type of application period, is how you're going to provide that matching requirement. And then additionally, there are a variety of federal regulations that are brought into play when you're thinking about applying for any type of federal funding, specifically to CFR 200, which is the Code of Federal Regulations as it relates to financial matters. So it governs anything from like how you do audits to how you address staff salaries, right? It's the whole laundry list. It's a massive regulation, and it really takes someone who's invested some time to understand. Most CPAs, if they have experience with federal funding, will be able to tell you about 2 CFR 200, but it's something that you'll want to spend some time with understanding and making sure that your organization's accounting practices are compliant there. And then, thinking about how you're going to track the success of the program. Do you currently use HMIS or a comparable database? How do you tell your organization's story of success? Are you tracking outcomes currently? You need to be able to demonstrate that you have the ability and the capacity to administer these types of programs in order to be most effective. Additionally, something that's really important to consider is how quickly and effectively your organization can scale. For example, if you have an agency budget of, $1 million and you request an award of $2 million from the federal government, how quickly would you reasonably be able to operationalize an award of that nature, right? So think really critically about what your capacity is to scale up projects like this. HUD is pretty serious. Once they've got an executed grant agreement, they want to see evidence that there's forward progress on it. Most federal grants operate on a reimbursement basis. So that means that you will incur costs and then be reimbursed by the government. There is a variety of financial tools available out there, things such as like factoring, where you can actually take out advances with a financial institution, and then they take the reimbursement. There's a variety of ways to do that, but that's something for an agency to really think about, what financial tools are available to them to be able to carry out these activities. And then specifically, like a lot of the things that we've been talking about today, there are a variety of unfunded requirements, right? Coordinated entry is a requirement of this Continuum of Care program. It's a requirement of SSVF, but it's not something that HUD or the VA will fund directly and as it relates to specific awards, right? So something to think about. Similarly, the point in time count, housing inventory counts, and then once the contract has ended, your APRs, like your annual performance reports, and any other type of closeout requirements that the government has for you. Next slide, please. So when we're talking to someone for the first time about whether or not CoC program or ESG or whatever is a good fit, we really encourage applicants to gather data about the problem that your community is hoping to solve. If you have not done a point in time count, you need to conduct a point in time count at minimum to be able to identify and quantify the need that you're seeing. If you have anecdotal evidence, that's great, but you really need some hard numbers. So if you've not conducted a point in time count, get with Ava and Kira. They're a great team that will help communities kind of get a direction going there. And again, I think I kind of alluded to it earlier, but building community support and buy-in for these types of advanced strategies is, I think, really important. Sometimes people are confused about what you're actually doing when you're saying that we're going to apply for CoC program funds, or what the CoC program can actually fund. And there are some, folks talking past each other rather than talking to each other. And then I think kind of almost to the end of my statement here is contact us for support. We have experts on staff who can help you design a project that has the greatest likelihood for success. Myself, Hope, or Axton on my team are all willing and able to work with anyone to try to help explore this situation. And then finally, be patient. If you do submit an application, the federal award process takes ages. For an example, applicants submitted request to the U.S. Department of Housing and Urban Development in September of 2022, and were notified of award today, right? So like that is a very long lead time for a project like this. This is not it's not going to meet an emergent need that you're identifying, but it is part of a bigger kind of long-term strategy. And I think with that, I will pass it on to, or I guess back to Margaret. Thanks, everyone.
Yeah, thank you, Jim. I'm going to talk to y'all real quick about the staff here at THN who work with the Texas Balance of State Continuum of Care, the different way we've grouped that, and then how to reach out to us if you need to. So we have 35 staff members right now at THN. You can see some of our pictures here. And here's some more. We have a few people that we don't have pictures for, but yet because they're brand new. But you can also find us on our website at thn.org. And I have our THN organizational chart here. And you'll see here all of these people that are circled are involved with the Texas Balance of State Continuum of Care. So it's the majority of our staff. And we have 4 teams: planning, data, engagement, and systems change. Planning, which Jim just spoke to you, he is the director of planning. They deal with CoC program funding as well as coordination of several other funds. They sometimes work in coordination also with the Texas Department of Housing and Community Affairs, which is TDHCA. The data team deals with HMIS training and assistance. Engagement deals with local homeless coalitions, CoC governance, and consolidated planning. And the systems change team develops coordinated entry and coordinates the annual appointment. And if you need to reach out to anybody, there's some contact information. If you need to speak to people about specific topics, please feel free to reach out. You can also reach out to individual team members by email. Our email addresses are just our first name at thn.org. So for example, my email address is margaret@thn.org, and there's my contact information there. If you need to reach out to me about anything. And again, I'm Margaret, and Mary is going to talk next about how to get involved with us, and I will pass it along to her.
All right. So you've heard a lot about a lot of different topics. We covered the highlights, we got into some details, but we understand that, this takes a while to get used to. It's its own lingo, kind of its own world, but we are definitely here to help you. And so we have a variety of ways that you can get involved or get more involved. So Margaret, if you go to the next slide, we want to talk a little bit about the concept of being a CoC member. We have a very broad definition of who is the CoC member, and it's really anyone who works or lives in our geographic area. And especially all housing and homeless services providers are considered to be members of the CoC. So there's no membership dues or requirements. There's no anything that you have to do to be considered a member, because we really want to have a broad representation of all kinds of stakeholders involved in addressing homelessness in our CoC. And so that means we have what HUD calls an open invitation process. So anybody can participate at any time. Again, there's not a certain year that you have to apply or pay dues or anything like that. So whenever you want to participate, we would welcome that. And just to note that being a member of the CoC, the Texas Balance of State CoC, is different from being a member of Texas Homeless Network, our agency. Texas Homeless Network plays a number of roles, and one of which is to work with all of the CoCs around Texas on things like advocacy and training and delivering the annual conference. And then we play this special role with Balance of State CoC as the CoC lead agency to support the activities of the Balance of State CoC. So it's a little bit different in terms of membership. But again, if you live or work in our geographic area, you are considered to be a general member of the Balance of State CoC. All right, next slide. So again, there are lots of different ways you can participate on the CoC level. As Margaret said, there is a CoC board, and they represent all the general members, and they're the main decision-making body for the CoC. And we have 15 seats currently filled, and half of those come up for election every year. So one way that you can get involved is by running for a seat on the board. We also have some committees within the CoC, so you could participate as a committee member. And all the items here that are in green with the underline are hyperlinks where you can learn more on our website. If you want to just give public comment on the types of policies that we're proposing to pass for the CoC with the board, you can check out our public comment portal. We also have some trainings and lots of informational videos on our YouTube channel. On the local level, you can join your local homeless coalition, or if your community doesn't have one, you can work with Jen and our other team members to develop a local homeless coalition. And then through THN itself, there are advocacy opportunities, and there are opportunities related to the annual conference, which, just to note, this year will be held September 27th through 29th in Austin. All right. Then you'll see I have links here to CoC general membership meetings. Today, we're calling this one the CoC orientation, which it is, but it's also serving as our spring general membership meeting. So we appreciate you coming. You can also subscribe to get our e-newsletter. You can view our website. There's a link to the news section on the BOS section of the website. And then, of course, following us on social media. We do post a lot of things on social media. So if that floats your boat, we welcome you to join us there. And so there are lots of ways to get involved and get more involved. And we hope that you'll be able to take advantage of some of those. And as Margaret said, you're always welcome to reach out to any of us by emailing our first name at thn.org. Thanks.
Thank you, Mary. All right, so we're getting close to the end here. So I really hope that the topics we covered gave you a broader understanding of what the Texas Balance of State CoC is. For more information, I would encourage you to check out, this is a screen cap of a presentation that's on the HUD website, the Continuum of Care Roadmap. And Craig will put a link to that in the chat. It goes into a little more detail about some of these things, and it will kind of give you a better idea of how all these pieces fit together. And it's kind of more broad to like COCs generally and how they work. Also, this meeting was recorded, so there will be a link to this video on our YouTube channel. It's just the THN YouTube channel. Just search for it on YouTube. And yeah, thank y'all for being here. We're ending like way earlier than I thought we would, so it's a great time. Thank you for being here. We also have a survey for people to fill out. Let us know how we did, and Craig will also put a link to that in the chat. You also receive it in an email after this meeting. And we will be doing the Q&A session now. So if you have any questions for us, please stick around, and Craig will be leading that. Are you ready, Craig? Oh, sorry, he's still putting the survey, sorry.
Sorry, yeah, I was chatting up some stuff.
Okay.
So we can stop the recording now.